I'm clinical psychologist Dr. Ali Mattu, and in this video, I'm going to show you how to deal with coronavirus anxiety. When I was an assistant professor at Columbia University, I treated a lot of anxiety related to public health scares, stuff like swine flu, Ebola, the West Nile virus. The patterns that played out with those viruses are a similar pattern to what I'm seeing now with the coronavirus. I'm going to show you how to stay safe in the face of this outbreak while also coping with and dealing with the anxiety that comes up as a result of it. Before we get to that, I want to just walk you through how health anxiety works. Your mind doesn't have an internal scientist. You're not weighing all the data and making decisions based on the raw facts. Your mind is an association machine. The associations it forms are based on things it can easily remember as well as strong emotions. The easier it is to remember something, the more emotional it is, the more likely it is that we're going to get stuck with these thoughts and have a harder time shaking them. It's kind of like Velcro. The more associations there are with visual images, the more emotional it is, the harder it is to kind of break apart this is really strong Velcro. Break apart those associations, get rid of those thoughts, and be able to move on with your daily life. For the coronavirus, images that are coming up are from the worst colds that you've had, the times that you've been really sick or people around you have been sick, all the images that you see in the news about people wearing masks, people being evacuated, and then also really scary movies where an outbreak occurred and many people died. Those images are very easy for us to remember, and they're being queued up combined with a lot of fear and anxiety, concerns about getting sick, something bad happening to you. And one of the things that really fuels anxiety is uncertainty. When we don't have all the facts, when we don't know what's going to happen, the more uncertainty you deal with, the more emotions related to fear and anxiety you will experience. For all of those reasons, you might get stuck with these associations, these memories, these ideas, these thoughts. They're very hard to shake, and you find yourself worrying over and over about the coronavirus. All of us are a bit more anxious because of the coronavirus. It's actually healthy to be more activated, more concerned, and more cautious when there is a public health concern like this. This is anxiety doing exactly what it's supposed to, protect us and keep us safe from danger. But let's talk about when anxiety might actually start to get in the way. If you find yourself worrying a lot about the coronavirus and it's hard to shake those worries, if you find yourself feeling very tense and more activated than normal, or you might be experiencing stomach distress, or it's hard for you to focus in the situation that you're in because of how active your body is, or if you start to change what's happening in your daily life, start to avoid doing certain things, or you might be doing a lot of extra things like washing your hands or taking an above and beyond extreme approach to being safe in your daily life. Those are the situations where anxiety might actually start to get in the way and you might be experiencing an anxiety problem. These types of concerns tend to also escalate symptoms for people who have generalized anxiety disorder, illness anxiety disorder, or obsessive compulsive disorder. The first thing you want to do is to continue practicing healthy habits. That means washing your hands when you're supposed to wash your hands, the way you're supposed to wash your hands, for the length of time you're supposed to wash your hands. This is the biggest thing anyone can do to keep themselves healthy. It also means getting a good night of sleep because that keeps your immune system strong. It means eating healthy food on a regular basis. It means going to your doctor annually and making sure you're up to date on all your immunizations and all your vaccines. All of that stuff is going to keep you nice and strong. It's the most important stuff you can do if you have any concerns about staying healthy. The next thing I want you to do is limit your media. Like I mentioned before, health anxiety is fueled by visual images and strong emotions like anxiety and fear. The more you go watching news or reading social media or searching the internet and finding some random, very scary forum, through Google, the more you're gonna see and create images that are very scary, and the more uncertainty you're gonna get. Your mind is searching for certainty. It wants definite information about definite things you should be doing and shouldn't be doing. And the more you go poking around the internet, the more uncertainty you're gonna find, which is gonna fuel the anxiety, which is gonna make all of these worries that you have even stronger and harder. This is very strong Velcro, harder to shake. So limit your media. What I do and what I recommend anyone who struggles with health anxiety does is, if you watch TV for your news, watch it once a day. If you go online looking for news, read the news once a day. Very much limit your social media, or consider even muting notifications or muting your timeline for terms related to coronavirus if you really struggle with this. Turn off all your notifications related to the news. If something important happens that you need to know, you will find out. Most of the time though, the breaking news or the notifications are really not that relevant to you. So limit all of that media use. And the one thing you definitely shouldn't do, don't type in some very scary search term into Google, because you will find a very scary related article or forum for that. That's how Google works. Google is also an association machine. It takes search terms and finds something on the internet related to that. I don't want you to do that. That is the number one thing that I found with my patients that fuels their anxiety about these health concerns. They'll have a scary thought, look up that scary thought, find a scary story, and now this association has been just strengthened. What you should be doing is going to credible sources of information. In the United States, that means the CDC. Outside the United States, that means the World Health Organization or your country's Department of Health, Ministry of Health, or health agency. All of these organizations are full of experts who are closely monitoring the situation and are biased to keep everyone healthy, reduce the spread of this virus, and accurately communicate that information with the public so it doesn't create a sense of panic or needlessly increase people's anxiety. You can also speak to your local healthcare provider, whoever that might be. They're also staying updated on this information and can accurately give you information related to your individual concerns. Next, make sure you stick to your daily routine. This is where anxiety about the coronavirus can really escalate, is if you start dressing differently, or avoid certain places, or stop interacting with certain people because you have these fears. Unless you've heard from a credible source of information, like the ones I just mentioned, that you need to change what you're doing, stick to your daily routine as much as possible. If you're struggling with this, like you have a strong urge to start wearing gloves, think of what 10 people in your community would do or are doing right now. If that doesn't help, you can also talk to 3 people, one friend, one family member, and a colleague or a peer, someone you work with or someone you go to school with. Ask them, hey, I have this idea. I want to start wearing gloves because I'm struggling with these worries about the coronavirus. What do you think about that? This can help you to get unstuck with these ideas and get a better sense of what is a realistic way to move forward while staying safe. Keep doing the stuff that already helps you with your stress and anxiety, whether that is exercising, playing video games, hanging out with friends, watching TV and movies. If after all this you're still struggling with anxiety and it's getting in the way of your life, talk to a healthcare provider, your primary care physician, or a psychiatrist, a therapist. Any of these individuals can further help you to move forward in a healthy way. If you want to learn more about anxiety, check out this playlist right over here. And I want to hear from you. How are you coping with the coronavirus? Let me know in the comments below.